At this time, it is my pleasure to introduce Rob Harding, the president of FormFast. Since 1992, Rob Harding has been the founder and CEO of FormFast, which is now the largest software company specializing in the healthcare vertical market for enterprise workflow. Prior to becoming an entrepreneur, he held sales and marketing management positions with several national document companies specializing in healthcare. His most recent role prior to starting FormFast was the creation of a best practice electronic document suite for the healthcare market. Rob holds a BA degree from Amherst College and an MBA from Iona University in New York. Rob also serves currently as the chairman of the board for the Gateway Homeless Services, which is the largest emergency shelter in Missouri for women and children. At this time, I'd like to turn it over to Rob.
Thank you, Laura, for the kind introductions. A resounding good morning to all of our FormFast users and visitors. I want to thank you all for attending what is now our 4th International User Group Conference today. We have a huge turnout. We're looking forward to bringing you up to date on new software features, service updates, and new products released this year. As the company president and CEO, I want to thank you on behalf of all of us at FormFast for your continued support during this past. I'm very proud of the people and the products and the services that we provide. As customers, you of course, want to know how FormFast is doing in these turbulent economic times and what it will be doing for you in the future. Unlike many of our peers, FormFast has continued to increase its sales and profits for the 18th profitable year. We have no debt. We're aggressively developing and releasing new products dedicated to the healthcare market. And in 2010, we now have over 800 users of our products. Our company is verified by Analytics, continues for the 4th year as the document workflow company with the biggest market share in healthcare, which is the best testament you can ask for. Despite the best efforts of application vendors who sell online documentation systems, there are, as you know, still thousands of forms and documents in every healthcare facility. Some are paper, some are electronic, but most of them in most hospitals are not automated today. We have a lot less clinical forms, but the administrative forms, there's still huge amounts of paper being moved around. So that's why our core fast print products eliminates pre-printed forms and obsolescence and merges patient data into the forms. That really begins the automation process just to start with an electronic form. Today, our customers are moving to completely paperless workflow solutions using our FastFlow brand. These applications feed discrete data collected on forms into your electronic medical record. We migrate our print-on-demand customers away from paper to purely virtual web solutions using FastFlow. And feedback is that our enterprise workflow product exceeds the capabilities of most workflow products on the market at a substantially lower price point. All vendors talk about workflow, but most offerings are narrow and often hard-coded into other types of applications. They often require teams of consultants to deploy them. Our FastFlow product is easy to use, as proved by over 100 of our 800 installations in healthcare who are fully up on the workflow product. Outside the healthcare market, it's reaching worldwide through our reseller network. We're incredibly proud of this product, which is the platform for our new rack audit product released at HIMSS, the physician query, capital equipment requisition, workflows, cancer registry, bedside signature, risk assessment, risk management, all reside on this workflow platform. Outside the line of business, your line of business, of course, being clinical work, it's used for HR and admin functions. Most clients contract with us to install and maintain their applications on a hosted offering, although you have the option of building your own workflows should you have available personnel. So this year, before our presentation of what is new, different, or important from our staff, I do want to take a brief opportunity to set the stage. We realize that many of you are not involved in the decision to buy our software. You may not be familiar with our company or products, and this may really be your first contact with us. You volunteered or were volunteered to support the product. So I'll ask those of you who know us well to spare a few minutes while we define who and what FormFast is. The first slide you see here shows FormFast Enterprise Workflow, and it's a new logo. It's a new approach that we're bringing to the market as we really move away from being just an electronic forms company or suite of products to a company which is doing workflow and utilizing the great tool set we have for working with forms to enable that enterprise workflow. So this is a new age, for us. So the new branding better describes the current offerings. So as background, we'll take only 6 or 7 minutes to just bring everybody, into the same, corral on who are we and where we come from. We were incorporated in 1992 in St. Louis. We were originally the developer of a suite of electronic form software, which is now enterprise workflow with strong form presentation components. All the source code is owned and developed in-house, and over 800 hospitals have deployed our products. The way this happened was in two parallel lines, one being a development path for our printing technologies and the other being for our web-based technology. So starting with the printer technologies, in 1992, we actually started by storing forms on printers and printer memory prior to the ability of networks to handle files that size. So, and then we've taken that, through all the levels of technology. We, in 1993, released Form Central, which was our mainframe solution for on-demand printing. In 98, we released Fast Print, which is our Microsoft server-based Windows solution. In 2000, we released Form Imprint, which was a great tool so that it allowed nurses to print clinical forms and orders as needed, and we would find nursing stations that had 2,000 or 3,000 different forms, including orders that they could print on demand. In 2002, we released our e-signature for patient consents. 2009, we added an RX secure feature. And so what do we have today? In the printing technologies, I show some of the common applications that people do. They're very heavy on admissions, on checks, job descriptions and evaluations, and probably the biggest thing that underlies all this is that we're generating forms with barcodes of patient and form ID so that they can be put into electronic medical record systems, which are not yet collecting discrete data. Then what about the other side? The parallel development of our workflow paperless technologies. That actually began in 2003 with our Fast Site product, which was a web-based repository, and it was set up to store all of your procedures, your administrative forms, any current document within the hospital could be stored here with version control. So that really set a platform to go out and whatever form or process you needed to deal with, you could go to this web-based platform. Then in 2005, what we did is we released the Fast Flow Workflow product so that you could now go out to this FAST site and you could pick things, pick a form or a function in which you wanted to complete a transaction. So we would click on the workflow, and we would start up. We would fill out a form or scan in a form, however that particular workflow started. We'd update databases with it. We would archive the results to our system or to a partner system, and we put a tool set in place that would build any application. That was followed shortly by our rack audit workflow and our now more general complete audit workflow package. So this is kind of the sequence in which we develop things. So the typical applications of workflow are HR, contracts, risk management, there's bedside consents, charge master. We have a list of 50 of them, and we will be talking on some of the more interesting ones ones where we receive a lot of inquiries. We're going to provide some detail later in the program. So you're a user of FormFast. Why is that? Why did your hospital select FormFast? And the answer is, for many, it was our dominance in market share. We were early in the game to really enhance patient identification and reduce errors. We were very focused on that. Of course, we're reducing a great deal of costs, and the rest of these are somewhat explanatory, but of course going green is a major factor for many of our current contracts, where there's a strong impetus to go paperless and to move to the top of our platform. Major technology partners over the years include these companies. I'll just have you look at them briefly, but we have very strong relationships and interfaces with a large number of companies. And what's becoming more important as we move on are conversion services, because whether you use printer resident forms or our older character-based Magic Client Server, Magic product, you may be moving, as everybody moves to new platforms, they need to move their document automation system along with that. So we have developed conversion programs and upgrade paths so that we can easily move our product into whatever the next environment is going to be for you. That obviously involves our consulting and services. We do a lot of contract form design, application development, project management, what have you. So, if you need, a plan for migrating from paper to electronic forms, or from electronic forms to completely paperless forms, just ask us to develop a plan for you. One of those plans that many of our customers take advantage of is the hosted SaaS system, where they require no capital or IT support. So that's a strong element. So, that's the nickel introduction of FormFast, and thank you for those of us who know us well for taking a few minutes to go through that so we're all on the same page. So what we see here now is, I believe this guy's meant to be a senior level CIO. He's actually somebody our ad agency found, and what he is doing is he is imagining. And he's imagining a solution set that would protect you, customizing solution set in-house, or being able to outsource that, bang as you go as part of your monthly budget. He's imagining that a solution could handle, any needs across the enterprise, and typically there are many requests to the IT department from departments for very specific packages from small vendors, which are going to be difficult for IT to support. So they're looking for a solution set that can handle all those needs, and they may be working. They want to work with somebody who's an established player. So I actually personally do not think that this guy has enough stress. Doesn't look stressed out enough to be a senior CIO, but we'll accept that maybe that's what he is supposed to be. So what we've worked on through this year, and what we've based our branding and development work on, is the idea of creating a high-performance hospital. So we'll talk a little bit about, how do we do that? What are some examples? What does that mean? But we're challenging you to become a high-performance hospital. So, what is this fast flow thing? It is the leading healthcare document workflow company, according to Forrester and Gartner. It's a company that we dare to imagine with you that we can get the job done, that we can overcome, the barriers to having departments work together. We are considered to be best of breed by just about all healthcare technology standards. So we are committed to long-term growth with our partners. We need to know what your needs are. We need to communicate with you, deliver results that you can measure and count on, and we can deliver to you expertise in hospital workflow, process improvement, and document automation. We have a very broad expertise across all areas. So we are really the bridge of communications between the islands of information in the hospital. So we talk to our customers. We talk about what do you really need? What do you need to have in place to make this work? What would it look like? And we talk to our partners and we say, what do you need? What are the holes in your product line? What do you need to complete a medical record? What are the outliers that continually haunt you? And then we look at the current state of hospitals and we say, well, how is it today? Well, today it's the clinical information is often well integrated. So it has a big silo. The financial, software has a silo. And then you have other, which is, if you're not, the hospital's probably using a couple of core vendors, and then everything else is either on paper or they could have, some large hospitals have 50 or 60 small packages being maintained departmentally. So it's this other that we want to put under one roof and one system and handle for you. So this particular hospital is being shown as busting at the seams and needs IT resources and capital resources. And we need to assist you in doing twice as much with half the resources, which is the challenge we continually hear. So how do you communicate? How does that get done? We want to get these silos connected to each other. They do well pushing to a central database, but not so much communicating with each other. So, and most of the time, the silo is a form. Everything isn't about forms, but that just happens to be the reality. Show me something that's not integrated and not automated, and it'll be a piece of paper of some type. So how do we get that to work for you? The silo effect is, of course, a lack of communication and common goals. It reflects that. So we go back to the evolution of forms. We show, really how does paper, how has the form evolved over the years. And this form is a cuneiform document from about 5,000 years ago. It's what passed for hard copy in those days. The data was important to them. It was a beer delivery document. And when we look at how we've progressed from that over the years, we really haven't, because a piece of paper has all the same characteristics. You can only read it in one place. It's not reusable. It doesn't communicate with anything. So the characteristics are very similar. Yesterday's stone is today's paper. So why is there so much paper? These are some of the types of things we hear. If I get a system, it'll be too expensive to change, that we can't get IT to support it, nobody will use it, and there are 800 hospitals who say that these excuses are not true. So we challenge you to walk the halls, and if you want to find the applications which we can take care of for you, look for those little inter-office envelopes, somebody with a mail cart trundling around, moving things physically around the hospital. And you will typically find those, your best candidates for workflow will be in that envelope. So the way we approach this is, as a pyramid that has paper forms at the bottom. It has the print-on-demand, print management forms in the middle. We at least have this as an electronic template that we can transmit, that we can merge with data, and then we end up at the top of the pyramid with electronic document workflow with completely paperless systems, or we just move through approval processes and update processes. So wherever you are, we would like to take you to the next level. So we talked about the other, what kinds of things would we want to do to partner with you on other solutions. And these are all goals that have been brought to us for which our customers are asking for help. So imagining, once again, our unstressed out senior CIO, he's imagining how this might happen. And the approach that we offer is a three-pillared approach. The print management on the left is what we've historically done for many years. Electronic signature capture, it continues to be very, very important, because most of the documents that are not being collected electronically, where we don't have discrete data, they're very often documents which are signed, physically signed by somebody. So it's kind of a category in itself. It's there to stay as far as we can tell, so we're going to give it its own pillar. Then electronic document workflow, which is really the core solution that's going to take us into the future. So looking with just a little more detail on each of these, of course, the fast flow for print management distributes forms. It does logic-based printing. It has your nursing interface to choose forms and people and generate packets. It allows you to auto-index forms using barcodes or pushing them directly into the electronic medical record with a cold process. And the kinds of things that we do with that product are listed here. We eliminate a lot of costs, and we set you up for the next level. print management for ER. What we're looking at here is considering output options now that you are capturing data on an EMR dashboard. You're capturing discrete data. You've eliminated a lot of forms. You have data in a database. You have a dashboard that you can look at and make decisions. And we don't do that. We don't compete with that. We don't in any way represent that we have an impact on that. What we are seeing, though, is that if there is a downtime that we are needed, to create electronic versions of these forms to keep the process going, we're seeing that when data needs to be output for use by another hospital when a chart is requested or for discovery, that there's a need to be able to push all this data out in a reliable format where we know where the data will be. So that's a big issue in 2010. Now that we do have some success in large-scale automation of clinical activity, how are we going to make that work, outside the nursing station or the patient stay? So we are in heavy development with several willing and a few less than willing partners to be able to output medical record data in formats which will be meaningful and acceptable to other entities. And we have some guests who will talk further on that. Electronic signatures, we're supporting more and more media on that. We'll be talking about that a little bit today. And then, of course, moving up the pyramid is your goal. We want to get to the top. So now we get into, the biggest pillar, the fast flow workflow, where, we're connecting steps, improving processes. We start out with, flow charts and figure out how to move these processes to paperless. At the 10,000-foot analyst view, is just looking at all the different things that need to be part of a transaction, or the kinds of things that we address that large applications vendors do not address, are, the transactions or, whether it's, processing an electronic form, whether it's processing an invoice for payment. These are, outliers to the database. So our goals, of course, connect your islands of information. And there's one system that does that, the FormFast Enterprise Workflow. So many of our customers are a little puzzled. They say, why are if these workflows are so important, and we do see all this paper around, why are the workflows not addressed? And most common, thought is no one offered us a solution, so I guess we must not have a problem. But really, the key application vendors continue to build the silos, be they financial and clinical. There's a lot of stimulus money associated with those applications, but it does not make all the rest of the workflows disappear. So where we do see workflow, it's embedded in expensive systems. We see that there aren't other vendors who focus on workflow for the sake of workflow. It's an add-on thing to another package. And typically 80–90% of simple transactions are not available in other workflow packages. So if you want to do administration or HR or something like that, the workflows from major clinical vendors will not address these. So The other side of this is that workflow vendors outside of healthcare are really not interested in creating affordable applications for hospitals, and the hospitals, of course, play into this. They are budgeting their money for AMR solutions, so they're not, welcoming vendors from outside of healthcare who, although they may have very expensive solutions, do have very workable solutions. So just so we know what we're talking about with what is a workflow. A workflow, and there's an example, is a purchase requisition, is going from a person, to a supervisor. And supervisor evaluates request. And in this case, this document will go to a supervisor or to someone else depending on the amount of dollars that are being requested. It requires VP approval if it's over $10,000. So here we have your branching logic, which takes this out for approval, and it goes to purchasing, and purchasing can then approve it or kick it back down the line to be redone. We can send it back, clear the signatures, unlock the data, move it back to the original requisitioner and say, this doesn't work, you need to start again. So we can go and visit any part of the workflow. So, what does all this mean to you? It means opportunity. The typical categories where we see, and we have, as I said, we have 50 to 60 workflows now built, but a lot of them are in revenue integrity, audit management, charge master, physician or clinician query, physician referral automation is a big issue. We're looking at enhancing the clinical experience, be it creating admission documents, whether it's an outpatient self-assessment workflow. We're ready to fill in any of the holes which are there. Compliance is a major objective. We can do the policy and procedure management. As you see, a variety of electronic signature, either through a regular written signature or a bedside system. So it allows you to visit a lot of different areas in the hospital where there's problems and opportunities, and use one tool set to do it. Another one is supply optimization, contract management, capital expense requests. These are all on paper. They're taking up a lot of time. Administrative excellence, one of those areas can be HR. HR onboarding is an application that is supported. Things like educational funds requests, leave of absence. Won't go through all these, but like an IT work order, check approvals. The list obviously goes on. Physician happiness is served by, we often do automated standing order sets for where physicians are not really ready for CPOE. We can at least allow them to submit their regular standing orders via a web system without having to sign it in fax it. They can they send that order in to your system completely electronically. Credentialing, of course, is important to making use of making the best use of your personnel. So a lot of areas we're ready to partner. We partner with the experts who have domain expertise. We've worked with a lot of consulting companies to make sure that we get it right, and then we have a track record of results. your imagination as to where you can take this. So with that, I want to thank you very much for your time. I know that that's a lot to swallow at once, but you know, we've defined, you know, the company and its history and what does it do, and really our main focuses and directions for the future. And now we'll move to a more detailed look of what exactly technically are we doing here, and how does that affect you. So I will hand this over to our technical team. And I thank you very much.